49 years after July 1968, I'm reminded that Harbor General Hospital never had a cardiac care unit before that date. Nurses were still required to wear caps, wear white uniforms, white hose, white shoes. Space for that unit was carved out of 2 existing rooms on 4 West, and it was the first area in the hospital with central ECG monitoring in the unit at a nursing desk. It was the first time in any intensive care unit where there was very highly specialized training for the nurses. The CCU nurses, thanks to Dr. Criley, were the very first nurses at Harbor to be taught to read EKGs, the first ones to be taught CPR, the first to be certified as mobile intensive care nurses. The big leap from CCU nurses was standing orders in a unit to be able to give orders to field paramedics from a base station. At the time that Dr. Criley opened the first cardiac care unit at Harbor General Hospital, the hospital was eager that publicity be given to this new service. A television reporter from KNXT named Jim Cooper came in with a cameraman in order to do a story on the new CCU. He typed out a script in the CCU, got into bed number 5, and memorized his script. When the camera started rolling, he started his narrative, but it was soon drowned out by the loud, high heart rate alarm. His apparently calm demeanor was revealed to be only skin deep. I'm sure that Dr. Criley had no idea that the program that he helped to pioneer would someday be called a TV show emergency, shown every week on TV, and a program that garnered a great deal of fan mail and interest all over the nation. One of my favorite letters, as they started pouring in from fans, one of my favorite letters stated, quotes, "This paramedic thing is such a good idea. Why doesn't someone do it?" Linda Jeffers was one of the original cardiac care unit nurses, mobile intensive care unit nurses, and paramedic instructors. She was a beloved nurse known to everyone associated with the program at the CCU. Linda was a tragedy. She had 2 cardiac arrests. The first occurred at home, and she had CPR by her roommate, and the paramedics, when they arrived, defibrillated her. The second occurred while she was driving south on the 110 freeway. She was found pulled over to the side of the road and was observed by a foreign tourist couple that saw her slumped over the steering wheel. They pulled over and they performed CPR. The event occurred when there was still a jurisdictional problem and issues of coverage, Los Angeles City versus Los Angeles County, and she was unfortunately in an uncovered area. She was eventually defibrillated when taken by ambulance to Gardena Memorial Hospital, but she had severe brain damage and did not survive. Dr. Criley got the Los Angeles Times newspaper to print the story, and eventually the jurisdictional problem was resolved. Diana Christie was one of the original cardiac care unit nurses, one of the original mobile intensive care nurses, one of the original nurses to ride with paramedics until the Wedgwood-Townsend Paramedic Act was passed. Interestingly, her husband was staying in a hotel in the Bahamas, and he developed symptoms of impending doom and summoned an ambulance. He felt that he was about to pass out on the way to the hospital, and he began to cough, having heard about cough CPR from Diana. And he was hooked up to an ECG monitor on arrival and found to be in ventricular fibrillation. He had used cough CPR because Dr. Criley had used cough CPR in the cath lab and CCU and found that the victim could maintain consciousness and better arterial pressure than could be produced with CPR. My name is Carol Bebo, and I was a nurse fortunate enough to be in the right place at the right time. Thank you, Dr. Criley, for providing these pioneering opportunities for nurses to go where nurses had never gone before.
My first full-time job was at Harbor General Hospital as a cardiac catheterization lab technician. I remember meeting J. Michael Criley and was immediately so honored to be part of a fantastic team of nurses, lab technicians, and X-ray personnel. At the time, I was a single mother of 2 beautiful little girls, and I was able to go home in the afternoons to spend time with them. My job was to run the electronics recorder in which pressures were recorded as catheters were advanced through the right and left heart chambers. Another part of my job was making the different catheters that were specifically shaped to enter the right and left heart chambers and coronary arteries in order to measure pressures and inject contrast media to record X-ray motion pictures. Dr. Criley also taught me the basic elements of photography, film development, and printing, as well as conversion of 35mm X-ray motion picture film to 16mm film in order to project motion pictures at medical meetings. I was also honored to be able to do tests on the first heart transplant patient in Southern California, performed at Harbor by doctors Richard Cleveland and Ronald Nelson in 1969.
After a rescue, Dr. Criley called us in for a meeting to discuss communications. He told us we were taking too long in delivering vital and personal information. We needed to get to the point. Later that day, we responded to a rescue at a market, and it was my turn to be radio man. We always try to be good paramedics. I condensed all of the personal information and the patient's vitals and relayed this information in a very speedy and condensed response. Harbor, Squad 36, we have a 54-year-old female complaining of chest pains, blood pressure 149/95, pulse 90. We are in a meat market cooler. She has had a hysterectomy and it's really cold in here. Over. After a long pause, the CCU started to respond, but all I could hear was lots of giggles and laughter. Later that day, I was informed that we could take a little more time.
I was on Rescue Squad 59, and Bill Ridgway was my partner. One morning after cleanup and checking the squad, we got a call from Dr. Criley. He said he was in a meeting with 20 other doctors at the hospital, and he wanted me to come over and join the conversation. He told me that they were discussing the future of the paramedic program, and the group had some questions for me. The topic they were discussing was whether doctors should give the proper dosage of medication to a fireman or just assign a color like blue, red, yellow, green for the medication, and then the doctor, all you would have to say is, Squad 59, give 10 cc's of blue. Dr. Criley asked me to explain why this was not a good idea. I gathered my wits together and stated that the emergency room doctors and nurses at Harbor General Hospital work long hours, and sometimes the doctors will work over 24 hours at a time. So the doctors and nurses have a system of checks and balances, where the nurses can question the doctor on the orders given is appropriate or not. I said we believe that we have the proper classroom training and in the field training. We also believe that for the good of the patient, we should use those same checks and balances. If we did not know what medication was being ordered, we would not be able to question it. Dr. Criley thanked me, and the rest is history. Gary B. Davis, paramedic number 0003.
When I began my tenure at Harbor General in 1967, there were 2 cardiology faculty positions filled by Steve Liu, seen here with Jim Lewis, our first faculty hire, and myself. We had 2 cardiology fellows. 20 years later, we had 7 faculty positions and 8 fellows, but we had outgrown the available office and laboratory space in the F9 barracks, which were constructed during World War II to care for military casualties from the Pacific Theater. We enlarged our space by annexing a trailer to house our electron microscopy and extracorporeal perfusion lab, but outgrew it within a few years. I was concerned not only for my current and future needs, but for our ability to recruit a successor who could continue to meet the needs for office and laboratory space to keep pace with the expanding needs in cardiovascular research. I had repeatedly declined offers to become the medical director of the St. John's Heart Institute in late 1986, which would have been a private practice opportunity at a prestigious hospital in Santa Monica, because I would no longer be able to teach and perform research, and I did not want to abandon my faculty and fellows. St. John's continued to apply pressure, at which point Frank DeSantis, president of the Research and Education Institute, predecessor to LA Biomed, suggested that we continue to negotiate with them and get their help in the construction of a St. John's Cardiovascular Research Center on the Harbor campus. These negotiations succeeded in the St. John's Foundation's agreement to help fund the construction of the St. John's Cardiovascular Research Center, as well as to provide financial support of basic research in the cardiovascular, infectious disease, and pulmonary disease divisions for the ensuing 10 years. We were successful in the recruitment of a new chief of cardiology at Harbor in 1990, Dr. Bruce Brundage, who brought with him the expertise to launch ultrafast cardiovascular imaging technology and the development of the Lew Pulmonary Hypertension Center, funded by Steve and Millie Lew. Dr. Brundage presided over the grand opening of the St. John's Cardiovascular Research Center in 1992. Seen in front is Supervisor Kenneth Hahn, whose support at the county level was instrumental in all of our achievements. However, at 4:30 a.m. on Martin Luther King Day, January 17, 1994, a magnitude 6.6 earthquake struck Reseda and Northridge, and ripples spread across the county, rendering the St. John's Hospital and Health Center unsafe for patients. Our cardiology fellow, Scott Zager, was literally moonlighting at St. John's that fateful night when the lights went out and the backup generators failed. Scott helped the nursing staff check on and stabilize patients in the dark. When I arrived later that morning, I helped the nurses prepare patients for transfer to UCLA, pulling chest tubes on several post-op cardiac surgery patients. My tenure as medical director of the St. John's Heart Institute was terminated shortly thereafter, since the Heart Institute facility in Santa Monica was unsafe for habitation, and the major focus of the St. John's Foundation became the rebuilding of the hospital from the ground up. 12 years earlier, in 1972, a 6.6 earthquake struck in Sylmar, reducing Olive View Hospital to rubble. A paramedic team, including Mike Stearns, was on site evacuating and assessing the injured. The chief of emergency services for the county came by and noted their white lab coats and stethoscopes and asked about where they were serving their residencies. When they replied that they were fire department paramedics, the chief went apoplectic and told them they couldn't play doctor on his watch. When the crew got back to the station, Mike Stearns got a magic marker and designed this wonderful jacket.